Congenital muscular torticollis is a special type of deformity most commonly occur due to birth trauma. Now, uh, the pathology for congenital muscular torticollis is when there is engagement of the fetal head. There may be a flexion, bend, or rotation of the head, and due to compression of the injury of the sternocleidomastoid muscle, and there will be repercussion injury. Then edema will occur, and increased compartment pressure that can cause again edema and compartment tamponade effect that can cause nerve injury. And due to muscle ischemia there will be muscle infarct, and due to muscle infarct there will be a sequelae as a fibrosis after the birth. So during the birth, if there is any trauma, that can cause a small hematoma, or during intrauterine life also, that during the engagement there will be a insult of that muscle, and that will act as a vicious cycle, and as a sequelae of this insult it can cause fibrosis followed by contracture. So this is also called sternocleidomastoid pseudotumor. Now this congenital problem may be associated with different developmental dysplasia of hip, and not only this DDH, it also associated with tibial torsion, club foot, calcaneo-valgus deformity, flexible place penis, metatarsal adductus, and hallux valgus. If the torticollis persist, the fetal skull, which is very soft, they can develop deformity. This is an facial asymmetry. This is called plagiocephaly. And characteristic of this congenital torticollis is mild frontal flattening, then tilted mandible, and flattening of the contralateral ear, and flattening of the jawline in the opposite side, and elevation of the ear, and and smaller eye in the opposite side, and that will be higher level also, and depression of the neck under the ear. But before going to the treatment of the congenital muscular torticollis, we have to exclude what are the other causes which can cause congenital torticollis. Among all the reason, one of the correctable and one of the most important reason is superior oblique nerve palsy. If the baby is suffering from superior oblique nerve palsy, you have to go for ocular examination, and there is a thing, this is called it's called macular fixation. Macular fixation most uh, important thing, due to we have binocular vision. After the age of 4 years, the binocular vision will go for macular fixation. So before that, if we cannot address this superior oblique nerve palsy, then this, after correction of this torticollis, patient can lost his binocular vision, and there is a chance of nystagmus, there is a chance of vision problem, and so on. And so this is an example of superior oblique palsy. After operation, the child get fine. Now the other differential diagnosis of the congenital muscular torticollis is Kefil-Field syndrome or Grissel syndrome, or any type of neurological or psychiatric causes of torticollis also have to exclude. And there is also associated with unilateral hearing difficulty, or autogenic torticollis is also there is a chance. Now non-operative treatment of torticollis is the manual passive stretching of the sternocleidomastoid muscle before the age of 12 months is the most effective mode of physical therapy. A, prog- mm, a program of the gentle stretching exercise should be included on the flexion, extension, lateral bending away from involved side and rotation towards it. Stretching exercise should be continued until the full neck rotation achieved. The cervical orthosis may be an adjacent treatment and supportive for the child whose lateral head tilt does not resolve by exercise, or older child with no longer tolerate this stretching. Now, before going to surgical treatment, the ideal age of the surgery must be at the age of 4 years. The reason I already told you, because after if we can correct the torticollis, but after this age of 4 years, as the binocular vision fixation is has been completed, so patient can problem with eye vision problem, and this is called a unipolar release. If only one pole is released, this is called unipolar release. And there in some resistant case we can go for bipolar release, means and the temporal part and the sternocleidomastoid part. And after this operation, patient must keep in proper physiotherapy, otherwise this fibrosis can occur again. So this is all total of the congenital muscular torticollis. Thank you.